Oral presentation 15. Lean body mass correlates better than weight and BMI with the levothyroxine dose required to achieve euthyroidism. Evidence from a cross-sectional study in Sri Lanka. The authors are Vijayakorn C.N., Vellala V., Praveena S., De Silva C.H., Vijayatunga U., Jayasurya A., Heva S.P., Gulugahapitia U. The presenting author is Vellala V.
Good morning, everybody. It's about the correlation between lean body mass and BMI and weight with the levothyroxine dose required to achieve euthyroidism. It's a cross-sectional study from Sri Lanka. So, I'm Dr. Vindya Vellala, Senior Registrar of Endocrinology from Colombo South Teaching Hospital. So the background, we all know the recommended approach for thyroid hormone replacement in hypothyroidism is usually weight-based. The recommended dose is 1.6 microgram per kg. That is what's given in the NICE guidelines as well as Sri Lankan guidelines. So we all go by that. But with practice, we have learned it's not always, we do not go by the weight. We have to reduce the doses and increase doses, maybe with the best compliant of the patients. It's not always the same weight-based dose. So the objectives were to assess the weight-based levothyroxine dose required to achieve euthyroidism and to determine the best approach for calculating the levothyroxine dose in group of Sri Lankan adults diagnosed with hypothyroidism. This is a cross-sectional study. Participants were hypothyroid adults who have achieved normal TSH with thyroxine treatment. So baseline data of a clinical trial conducted at Endocrine Clinic of Colombo South Teaching Hospitals were studies, and the data collection was done with interview administered questionnaire. TSH was done at the hospital laboratory using standard methods. Body weight was measured with calibrated weighing scale. Lean body mass was calculated with Hume formula, which based on weight and height. And there's slight difference for male and female. Ethical approval was obtained from Ethical Review Committee, University of Sri Jayawardhanapura, and informed consent was obtained from all the participants. So we have studied 56 participants. Majority were women, and the mean age was 48.7. And the mean body weight was 60.5, and the BMI, there were 26.8% who had more than 25 kilogram per meter square BMI. The TSH mean was 2.21 micro international units per milliliter. The median was 2.15. So the causes for hypothyroidism in this population, majority were autoimmune diseases, and there were thyroidectomy and radioiodine treatment patients as well. All patients claimed to take thyroxine in the morning on empty stomach, and few were on iron and calcium supplements, which were not obstructing, which were not interfere with the absorption of this thyroxine. And the results were as follows. Levothyroxine dose required to achieve euthyroidism. The median dose was 75, mean 82.6, which ranged from 25 to 175. And body weight, according to the body weight, we have calculated that 25% of patients required more than 1.6 microgram per kg, that means weight-based dose. So majority, 58.9% required less than 1.6 microgram per kg per weight-based dose. So, and the correlation between the weight and the levothyroxine dose does not show any significance. The p-value was 0.1. So then we calculated the correlation between, whether there's a correlation between this required dose and the BMI. So that also does not show any significance. P-value was 0.3. And then we go ahead with calculating the lean body mass with the available data, weight and height. So at that point, we saw that there's significant correlation between levothyroxine dose and the lean body mass. So the lean body mass base dose mean was 2.1, median was 2.1. So when we searched the literature, there were evidence from the previous studies. Most of the studies indicate that using BMI is more accurate than using total body weight actually. But there were few studies that used lean body mass, and they have shown that lean body mass was more accurate, even more accurate than body weight, than the BMI or than the weight. So in conclusion, majority of the study participants achieve euthyroidism with the dose less than the recommended total body weight based dose. We saw that 58.6% were required less than 1.6 microgram per kg dose. So lean body mass correlate well with the levothyroxine dose, with significantly to achieve euthyroidism. So total body weight and body mass index did not correlate with the levothyroxine dose to achieve euthyroidism in this study. So finally, I would like to acknowledge all the participants who gave consent and participated in this study, and thank you.
We can go ahead with the question.
Okay, thank you for a good study. What I want to know is now, all the patients who were included in the sample, were they euthyroid?
Yes, madam. They had normal TSH for 3 months continuously. Yes.
So you have given the mean as 2, but they were all within the range. There were no patients who were below the normal range 0.5 or above 0.5.
No, we did not recruit those patients on
Only ones who were within the normal range for 3 months.
3 months, yes.
3 months. Okay. Why do you think that in our patients the lean body mass correlates more compared to the total body weight or the BMI?
The theory behind that was not fully understood. Actually, I searched a lot of papers for proper answer for that. Probably the lean body mass is when we deduct the fat content from the total body mass, we get the lean body mass. So I think there's no significant weight. I mean, the significant benefit of weight from the fat percentage regard this thyroxine dose. So the reason behind that was not fully understood.
The distribution of thyroxine into fat tissues or something like that. Have you looked into that possibility?
It is probably, but it was not very much mentioned in anywhere, and it's probably the cause, but there's no evidence for such.
But did you say you needed a higher dose rather than when you calculated the BMI? When you have something 2.1, is that correct? No, maybe I got it wrong. And usually your thyroxine dose will depend on the degree of hypothyroidism also.
Yes.
Yeah. So have you taken any account to your study whether they had very high TSH levels, or whether they all had a similar TSH levels to begin with?
The all had euthyroidism measured by the TSH level, madam. So no, after yes,
Yes.
with
Before
on
that, when
thyroid.
they had started with the people who have a very high TSH, probably they will need higher doses of thyroxine. So you don't know whether they were they were equal at the beginning.
That of course we did not look into, but once they were recruited study, they had the same the normal TSH within 0 to 4, and the mean TSH was 2.1. So they were not on very high dose. Actually, most of them, to achieve this type of TSH, they required around 25, 50, 75, not like 200 or so. So
Be a special group of patients, is it?
And the evidence from the other studies, madam, they also taken into account this autoimmune diseases, thyroid ectomies, and various types of hypothyroidism diseases, especially thyroid gland and also thyroid. So they have not mentioned regarding the level of TSH and the dose of thyroxine.
Right, thank you.
Thank you.